Good morning all, Dorothy here from CCMA, and delighted to see you joining us this morning for another in our series of CCMA Community Chats. I'll do the formal introductions in a moment. We're going to, as normal, give everybody a couple of minutes to log in. Certainly this webinar has been of particular interest, and we have a lot of people due to register this morning and join us. So we're going to give till 11:02 just to let everybody log in, as they say, and I think this is very much a hot topic what we're discussing. So on screen you'll see Cormac Farrelly and Shane Farrelly, and if you see a resemblance it's because they're brothers, so we can get that out there straight up. And Shane is joining us from Portugal. Cormac is in beautiful Howth, and Shane is a specialist in the whole area of mental health, but also occupational health, and I'll let him explain his own credentials shortly, but very much an expert in this area, and is working with a lot of companies currently during the COVID-19 crisis, helping them, you know, get through the challenges that it's placing on a lot of companies, but also talking to them about, you know, planning for a phased return to the workplace. And we certainly know there's no dates yet, but we know companies are already looking at this, and that's really part of today's webinar, is to have a discussion about that. We want to make it as interactive as possible, so as always, please send through any questions that you have. Shane has a couple of polls that we're going to run during it, which I think everybody will find of interest. But please do put your questions out up onto the chat section, or the question section on the right-hand side of your screen. And as always, we'll offer a recording of this webinar later, and Shane has some very useful links that we'll have available later as well. So it's 11:02. I'm going to hand over. Thank you very much, Shane, and obviously thanks to Cormac once again from WSI. And Shane, I'll let you do the introductions of yourself if that's okay. Thanks a lot.
Yeah. Perfect. Okay. Well, first of all, good morning to everybody, and thank you, Dorothy, and thank you, Cormac, for inviting me to come along and actually to present today to your community chat session. So I'm actually an occupational health specialist, and an interesting piece on that is that a lot of people have actually had interactions with an occupational health specialist, probably more in relation to absence management. So it might be that you may have had members of your team who've been out of work for a protracted period of time, and what you're looking at, you contact your colleagues in HR, and they refer to an occupational health physician to determine, one, when the person will be in a position to return to the workplace, and two, when they can return if any accommodations are necessary. However, another part of what occupational health physicians do is they help in conjunction with your colleagues in health and safety to ensure that the workplace is safe. So what we're looking at doing is making certain that if there are any risks in the workplace, that we can minimize them, and we can actually put in place protocols to allow that basically to happen. And of course, that's where I actually, as an occupational health specialist, like a lot of my colleagues, are actually advising basically companies as to how they can actually protect their employees during this space. And of course, we're all taking our lead basically from the HSE, and of course also from the World Health Organization. So I think maybe one of the aspects of this is that in my particular role as an occupational health specialist, an international occupational health specialist, so I provide support to organizations in different countries, including of course where I am now currently in Portugal, but I also actually am on the cover LATAM as part of my remit basically as well. So it's the same thing, you're basically dealing with people right across the board. So I think maybe to maybe give a bit of an overview, because you'll know from this we're talking about looking at the overview of current status of COVID-19. And I think it's very important that we actually are positive to start off with this, because there can be a lot of negativity and a lot of doom and gloom. And I do understand, I don't want to make light of that, that's significantly impacting people's livelihoods at the moment. And we're all collectively doing is ensuring that we can minimize that particular impact at the same time as actually keeping people safe. So maybe to have a look at what we would normally do. So the key aspect of that is that when we're looking at how do we keep people safe, we look at something called a risk assessment. And I think that's an important aspect, because if we go back to healthcare workers, which of course are very much center in this, and they actually are helping to protect us all. If you go back to basically the Ebola outbreak in 2014, basically out in West Africa, there were a lot of Irish physicians and UK physicians that they went across to West Africa to actually help in that fight of Ebola and protecting people there. And there were no fatalities on the back of that. And that's because an appropriate risk evaluation was done, there were protocols put in place, and there were appropriate PPEs put in place. If you also go back then to the current basically crisis, if you can, I probably get the pronunciation wrong because my Italian is not good, but outside of Naples, there's actually a hospital called Cutuna. And that is actually has been designated, that was designated and still is designated as a COVID-19 hospital. So it's actually dealing with all of the COVID-19 cases that are in that vicinity. And there has been no fatalities among healthcare workers in that space. And that's because they've got protocols in place and they've got PPE. And of course, right across, we've actually seen right across the countries, all of the healthcare workers saying, look, we do require more PPE in order to effectively manage basically people basically going forward, and that actually makes a lot of sense. So what I'm actually going to do, May, first of all, just before we actually just run the first poll, is look at what are the criteria that are actually put in place to look at easing up the lockdown, and maybe also to give a little bit of concept about issues like the word herd immunity, which is being bandied about, and why herd immunity as an entity is not something that actually is going to be an effective model. So first of all, if I actually talk about herd immunity, so herd immunity is when a proportion of the population are vaccinated, and that therefore prevents basically other people from becoming infected. And a good example of that basically would be mumps, where we do have a vaccine now. Of course, as yet, we don't have a vaccine for COVID-19. So basically mumps, you'll all have heard recently about the RO, the reproductive factor. And as we know, basically with COVID-19, before social distancing came in Ireland, that had a factor of 4. Now it's down to between 0.7 and 1, which is actually very good. And mumps, to put it into context, has a reproductive rate or factor of 10 to 12. So that would basically mean that without vaccination, roughly 95% of the population would get the infected over time, and 5% of the population would have a natural immunity. And for mumps, you need 92% of the population to be immune for the disease to stop spreading entirely. And basically that we do know that in relation to COVID-19, if the replication factor was about 4, that would be less, but you still need to have 70% of the population basically protected before you'd actually prevent the infection. And that's why you would need a vaccination. To put that basically into perspective, there has been some research done recently basically in London by one of our own doctors, Dr. Moran, and they're talking about the percentage of the population in Ireland that have actually got infected currently is somewhere between 6.5 and 16.5%, whereas in England it's about 19.5%. So as you can see, way off that particular figure of 70%. And the second part is that they're talking about a number of waves coming through, potentially 3 waves. So of course, the first thing we've done extremely well is that we've come along, we've actually have contained it, and as we all know, not actually overrun basically our hospitals. But then the next question is, how do we actually get people back into the workplace safely so as we can help protect the economy basically as well? And the WHO have come across and given basically some guidance in relation basically to this. And I'll just go through this very briefly then with you, first of all, and then we'll actually run the first poll, Cormac. So the first WHO have got 6 criteria. The first is transmission of the virus under control? And that would relate to communicable diseases and the replication factor being down. Second, is the healthcare system equipped to detect, test, isolate, and treat every case, and then trace every person who comes in contact with a positive case? And of course, you need to get the results of your contact tracing to be effective within 24 hours. That has been a struggle for the HSE, but they really have got on top of that in the last 48 hours. Third one is, are the outbreaks minimized in special settings like health facilities and basically nursing homes? Hospitals, of course, in other countries, particularly Italy, was where there's significant, of course, concerns, but we've actually had significant concerns in our nursing homes. Then are there measures in workplaces and schools to prevent the spread of the virus, which we'll be talking about later on this morning? And are the risks of importing cases from outbreaks from outside the country being managed? And then 6, are local communities educated, engaged, and empowered to address the new norm? So maybe just looking at that place, maybe if we run the first poll as to basically when you feel looking at that we might be in a position to consider returning to the workplace. So Cormac, perhaps you might run that. I'll give it a few minutes to come through on
Okay,
that.
Shane, yeah, that's running there now, so maybe we'll give that about 30 seconds or so.
And I think it's interesting, just for people who are on some of our earlier webinars, we did run a similar poll. I think, was it about 2 weeks ago now, Cormac? It's hard to keep up. And at that stage, I think half of the people suggested June time. So I think it'll be interesting to see how people's perspective has changed in the intervening couple of weeks.
That's right, Dorothy. I think it was John Reardon from Shopify who ran that one, right?
Yeah.
Okay, so just give it the last couple of seconds there now, and I'll close the poll, and I'm now going to share it on the screen.
And just while you're doing that, just to say, Morris has asked a question, Shane, where you can get a copy of the guidelines, and I think we're going to give a link to that at the end as part of your presentation, just to let Morris know.
Yeah, absolutely. Basically, at the end of this, there's actually a slide with all the relevant links.
Great, thanks. Thanks, Morris.
Okay, so looking at this now, we're talking about, that's actually quite interesting now that basically, 33% basically have been actually coming back as actually thinking about the 2nd of June, and 28% basically looking at basically the 19th of May and then 6th of July. So we're talking about the majority of people are looking at, we're probably going to get back in some capacity up basically before July, which is actually is quite interesting. It'll be interesting, to see what Leo Radcliffe comes back in the conversation. I think the 19th of May is probably going to be a little bit too early, and I think the issue is going to be that, in addition to that, it's going to be, I think, probably more likely to be the early in July, basically in a different capacity. But maybe we might just run the second poll now, because it actually is relative as well too. And so, working on the assumption that you are bringing your team basically back, looking at what percentage basically of your team do you feel you will be getting back basically in the first trolls of this cycle. So as we're talking about potentially looking at this basically being sort of 19th of May or basically into June.
Okay, that's running there now, so maybe we'll give it another 20 seconds or so.
And I think that, I know the three of us had this discussion yesterday. We're hearing from companies that they're recognizing that, if schools aren't back, people with childcare issues won't be in a position to come back to the workplace anyway, or people obviously with underlying conditions. So it'll be interesting just to see what people's view is in terms of what percentage can physically come back, apart from the company facilitating, but actually people who can actually leave their homes.
Okay, thanks everyone. So I'm just going to share the results there now.
Okay, so we're talking about sort of, I mean, on this is about sort of 40%. Looks like basically coming back, basically, and then the outliers then basically being in around about the 10%, and there are some people thinking potentially maybe 100% of people may actually come back. Okay, that's excellent. That's very, very helpful. And then what we might just do is run the third poll as well, because they're all interconnected, and it allows me to move on to the next part of the presentation. And the issue that we're kind of looking at is, who do we think is going to be the responsible person within the organization to make that particular call about basically who returns to the workplace?
Okay, that's running there now.
And you'd be delighted to know it's the last of the three polls.
Okay, I think the results on this one look like they're pretty overwhelming. I'm just going to pause the poll now and share it.
Okay. Okay, exactly. That's perfect. Okay, so and that is absolutely what it should be. Is the executive board actually are making the decision? And I think what we're looking at then in relation to that is that they will require to have input then from basically their EHS manager. They'll have input basically from the HC recommendation, and also basically from their own occupational health specialist to kind of give them a guidance as to how they can bring back this in safely. But equally as importantly, they're going to actually require basically information from yourselves. I know we're speaking to the senior management here this morning, and they're going to really know is from a business perspective, how are we actually managing? The kind of questions might be is, okay, if you are actively running quite effectively with your team basically at home right now, will you wait until we get maybe a little bit more ahead of the curve rather than bringing them back, and you be actually giving them an indication as to why you basically feel people actually require to actually come back into the workplace at this particular time. So then I think if we actually go back then, because this actually brings us back into looking at the hierarchy controls we're speaking about, first of all, and basically what we're looking at in relation to the risk of actually being, or how we actually look at bringing people basically back into the workplace. And a couple of things that we look at is, so the first thing we look with any particular risk assessment would be looking at eliminating the risk. So that really means that the bottom line is somebody who doesn't actually need to be at work doesn't actually come into work. And what you're talking about there is determining is what particular underlying medical conditions that a person has that could put them at increased risk. The other part that you look at then are the engineering controls. This is something that we all need to think about. One of my roles is I've been giving some support basically to the essential workers in the production area, principally basically in the pharma world, the people who manufacture the various catheters, the syringes, the needles, etc. And of course, they have actually remained basically in work throughout all this period. And of course, as you will no doubt be to a degree familiar, a lot of the work that can be done in pharma or basically in production for producing catheters, etc., can actually be done in a clean room environment. And a clean room environment, you can't actually be basically 2 meters apart from the other people. So you need to put mechanisms in place where you can protect them. And one of the things we looked at there was we actually were talking about people actually wearing masks. The rationale behind wearing a mask is that basically 25% basically of the population can be asymptomatic, but yet spreading. And I think what's important to come back a little bit on that part in relation to masks and the questions about plus or minus, and I think lots of talk basically around that particular side is a mask is designed essentially, if you like, as a one-way valve to a degree. It's to prevent you infecting somebody else. It's not to prevent somebody else actually infecting you. And if we go back to first principles, the whole process is this is particularly spread by droplet secretion. So it's spread by coughing or by sneezing. So if you are asymptomatic, but you still have a cough or a sneeze, if you're wearing a mask, you're not going to actually end up passing that on to somebody else. So you're providing protection. And we initiated that basically in the clean room environment. We also initiated basically in the clean room environment everybody actually wearing gloves. They were doing that anyway, but we made sure they did regular changes basically of the gloves. And we also had a protocol in place about how long they would actually wear the gloves for. And basically we also had a situation where they actually wore glasses in that environment because it prevent them more or less from scratching their particular eyes. And then we initiated basically issues like social distancing in relation to people going to the canteen. So at that point in time, they were not wearing they were actually wearing the mask, but they were also basically were being 2 meters apart. Now, obviously, for the eating aspect of it, they weren't wearing the mask. They were taking the mask off when they were getting there, but they were staying within that 2 meter apart side. We also had a very significant protocol basically in place whereby if anybody had any specific symptoms, they did not present to work. So those symptoms are the ones laid down by the HSE, which is talking about somebody having a cough, somebody basically having a fever, somebody having a sore throat, or somebody basically having a sneeze. So they are the process there, and those people did not go into work. How we ensure that is we actually, every will have different ways of registering in their situation. They have a clock-in system. So we measured out 2 meters from the clock in. We had the sign basically at the door. So one person clocked in at a time. And then we're talking about people on the line where they were actually working beside each other. We actually made certain that there actually were partitions, perspex partitions put up between people, and people entered in a certain area. So what happened was that they entered, basically one person went in, and when they were settled in, the other person came in. So we maintained basically the social distancing. The other part was as well too that with people starting work at that time got staggered. So rather than everybody coming into the office through the door at the same time, they got staggered at basically 10-minute intervals. The other part then was in relation to the canteen. That what happened was that we had regular washing basically at the canteen, because we do know the other way you can pick up basically coronavirus is actually from a surface where someone's coughed onto that surface, and then you scratch your eye, or scratch your nose. So we know that in general, different surfaces, there are different timelines, but in general, you're talking about the coronavirus or COVID-19 can survive for 72 hours. So what happened, a lot of the organizations, certainly the pharma, they actually got their cleaning staff to come in and do more regular cleaning. So essentially what was actually happening in that particular space is that they were coming in, they were basically washing the tables down before people came for food, washing them down afterwards, and they were doing a routine basically every 4 hours. and people in their own workstations had the responsibility of cleaning their own workstation when they came in, and again before they went at their various breaks. One of the other important parts to consider going back into the work environment is how you're going to look at things like the washroom, because it's very important that social distancing is maintained basically there as well. So there will still require to be social distancing even when people are actually coming back basically into the workplace, because we want to make
Shane,
sure Yeah, go ahead.
Raise a question. So question is social distancing in contact centres. Does Shane have any recommendations, i.e. groups sit in teams? So I think for a lot of people on the call, if they're hoping to get 40% or thereabouts their workforce back, what do they need to be thinking about, and how do they manage teams who'd normally obviously sit in clusters together?
Okay, so I think what you're talking about there is an excellent question. So the first thing is that social distancing still remains the norm, plus of course the constant hand washing techniques, plus the washing down the surfaces. Now, the key aspect of this is that because we know 25% can be asymptomatic and potentially spread, what would really have to happen is that where there was a situation where people were going to be very close together, and this has actually happened within a variety of board meetings and stuff at the moment, if they have to be closer than that 2 meter to each other, that they would wear a mask. By wearing a mask, that will protect them from spreading to somebody else that they have, and therefore if everybody's wearing a mask, it'll protect the other people. And that's probably what part of the guidelines is going to actually come through from the HSA when people are going back into workplace.
So would you be saying to companies that now they should be looking to get these masks, even though we know a lot of it, you know, as HSE are saying themselves, they're like gold dust, but in preparing for going back to work, at a minimum, you're saying companies will need masks?
Yeah, I think basically at a minimum what they're going to have, they're going to have some type of PPE. They're going to have gloves, and they're going to basically have to have masks. So I think they're the two aspects in relation to that. So it is very much the new norm. And if you're talking about, you know, looking at when the WHO recommendations, when they were talking about people actually coming back basically into the workplace, they're talking about our local communities educated, engaged, and empowered to adjust the new norm. And this is really what the new norm is basically about. So absolutely, the HSE initial recommendation, of course, was make sure that basically the masks, etc., are available for the healthcare workers. That has to happen. But now they have moved forward on the curve on that. They're actually working at getting that. So when they're looking at people coming back into the workplace, they want to be absolutely certain that they don't actually have increase in community spread. So in that particular situation, there will be a requirement for people in a close environment where they're going to be outside of 2 meters having masks. So for example, the pharma are already basically doing that.
And one other question, Shane, I know we spoke about this yesterday when we were preparing for today, and I talked about, I'd got some literature from a contact of mine of these machines that take people's temperatures, like a scanner, and whether companies should be looking at things like that. And you had an opinion on that. I know
Okay, there's a couple of interesting things basically about that. So I think the first aspect that you're talking about, so they're talking about these as being infrared thermometers. The original information basically about this was that they weren't actually terribly reliable, but that seems to have improved in more recent times because the whole issue is changing. But the key aspect of it is that fever is only one particular symptom. And you're talking about that people would be contagious, they would think, for probably in the region about 14 days before they actually have a fever. So a lot of organizations to date, what the pharma are doing is they're asking people to complete their questionnaires. People are very honest about this, and they actually, if they have a fever, they don't basically come back into work. Should a situation arise where they subsequently do a fever, then occupational health will actually get involved in contact tracing the people around that. And we've gone back a period of 2 days from where a person became symptomatic, although 14 days is thought to be the contagion, but 2 days is where the majority of the cases will tend to be at. So the key thing you're looking at is if you're bringing in temperature aspects, you need to think a couple of things. Is one, you need to basically look at basically the sensitivity, the specificity, and the negative predictive value of the machine you're taking on board. So a sensitivity is actually the true positive rate, and that should be of the order of 97%. The specificity is a true negative rate, and that should be 97% also. And the negative predictive value should be 99%. So that's the probability that you don't have the temperature. So you want to make certain that if you utilize the machine, is utilized accurately, and as a consequence, the person who's taking the measurement has got to receive appropriate training on that. Now, if you go back to where we were in the very beginning of COVID-19, the Irish government, and I feel correctly, made a decision not to bring in temperature testing at the airport. And it was for that very reason, that the evidence showed that you were not going to pick people up basically at a stage, basically, you know, because you're going to get them. And indeed, when they looked at some of the other organizations, other countries, they found that over 50% of people actually coming through turned out to be COVID positive, but ultimately ended up having tested negative at the airport by countries who actually had the temperature screening piece.
And one further question, I'm conscious of time, we have about 5 minutes left, Shane. I know you want to talk about mental health and stress, but yes. One further question, should the company provide individuals with small cleaning kits so that they take responsibility to clean their own area?
Absolutely, and that's what we've actually introduced in the farm, and it's been very effective because, touch wood, we have not basically had any COVID-19 case within the industries that have been covering around Ireland, of which there are quite a number of it, and it is absolutely down to the fact that people themselves have been taking responsibility and they have got their own solution where they're cleaning their workstations basically and cleaning their desks absolutely themselves. And then I think moving on from that, I think, and I know we've got probably tried to take on too many, but perhaps we might come back and discuss this later. But the issue then basically around the mental health aspect in relation to that, and there are links at the end of that. The first thing people have to actually take into consideration as managers is there's going to be a significant fear factor. And this is something I was actually finding with people. So we would have a manager who potentially would require to go onto the production line basically one time basically per week to make sure everything is actually running appropriately. The example I will give in relation to that particular person's case, unfortunately, his wife was actually diagnosed basically with cancer. Basically had an operation, was now on chemotherapy, and was running to the hospital on a regular basis once every 2 weeks for chemotherapy. And they also had a 16-week-old infant in the house. His concern was he goes to work, he picks up COVID-19, he brings COVID-19 basically back and basically passes it on to his wife. What I was able to say to that person with certainty, and that's why the protocols are so terribly important. That's what we refer to in our assessment as administrative controls, which we'll have a link on. But the importance of the protocols, I was able to assure him he was far safer going into the workplace with the controls that were in place than he would be going to the local supermarket, even though he was delivering, or going actually into the hospital. And the advice I was able to give him was that it would be appropriate that he and his wife would stay in the car until such time as they were ready for them in the hospital. So they went directly into the slot where basically they actually ended up getting the chemotherapy. So that's one aspect that people will actually have is a certain fear, and the fear about going back, the fear about traveling on public transport. So again, in public transport, they should wear a mask, they should actually wear their gloves, because they'll be concerned they're going to pick it up, maybe not necessarily in the work, but actually in going basically into the workplace. And then I think that the final part I'll end up, because I know we've actually only got about 2 minutes left here, and the links will give information here towards the end, is that a manager should, with the information there, be able to pick up if their colleagues are having mental health concerns or stress-related concerns, but very important, they don't take ownership for the mental health. So their process, they say to the individual, what I as a manager can help you with is maybe reducing your workload or changing how you're doing your job around. Maybe I can do that, but you must go to EAP, Employee Assist Program, you must go to your treating physician, you must go to your GP for your ongoing treatment. And the second part is that if it's becoming quite complex, you go back to the default position. You contact HR and say, I've got a person who's struggling. Can you organize a referral to occupational health to make recommendations about that particular colleague's fitness for work? So I think we're probably nearly.
I have one more question. Thoughts on rotating staff? One of the webinar attendees has asked if you have any suggestions on that.
Yeah, so that's certainly what the farmer basically is doing in relation to that. So once everybody's actually is trained up, I think really at the end of the day, what you're talking about is that people have concerns when they actually are going in, mainly about getting into the workplace. So if they are rotating and therefore as a consequence have to go into the workplace less frequently, they're going to be less anxious and you're going to get a lot more buy-in. I think it's huge about communication. The communication to people, they need to understand their work environment is safe and it's not going to increase their risk. And having a rotation model in place is absolutely very helpful. And we've done that in the pharma world, in production pharma, I mean now. Office farmer.
And just last question, and I think we'll squeeze slightly over the 11:30, which I'm sure is fine because I think there's a lot of engagement on this session. So companies now really should be preparing their protocols, is what you're saying. They should get an understanding of who would be available to come back to work, or who should be considered essential in a way to come back into the office. And they should be looking at protocols for things like, I know we talked about it yesterday, even using toilet facilities, things like that. So apart from canteen at their desk, it's the whole environment of the operation of the organization.
Absolutely, and I think one of the first things that people should be doing basically as a step going back is maybe setting up a protocol about vulnerable people. So we've actually provided some support basically in a couple of other organizations where they are essential and they are coming to an office type environment. And what we've actually said, look, if you feel you're vulnerable, fill out this particular questionnaire. If they're not unsure, I think what happens is to use your occupational health nurse or your occupational health physician basically as a resource to come back and have a conversation with the person. So if they are vulnerable, and there's some information coming out at the moment that people who actually are basically have metabolic disease, so in other words, they've actually got diabetes, or they actually are overweight, or have a comorbidity where they've got both, and if they've hypertension, they are at increased risk. Also, the people who are increased risk is sometimes people forget about this. Person's taking an arthritis and is taking an immunosuppressant to deal with their arthritis or to deal with their bad skin condition like psoriasis. Those people are actually at increased risk. So if you're in the vulnerable group, unless they were, you should be doing your very best not to let them continue to work from home if that's basically at all possible. So I think you need to, one, have the protocols, but secondly, you need to seriously look back and say, who do we really need to have in at work? And what you're trying to do is to push this out, because I mentioned very early on about the herd immunity. That really only works when there's a vaccination. Now, I think vaccines may come, a little bit sooner than people actually are thinking. A lot of people are thinking vaccinations maybe around December. Now thinking that mid-November, mid-September, early October, there may be something. So the longer we can actually push things out to have less people in the workplace, protecting the economy and protecting the healthy individual, the better that's actually going to be. So that's why you're looking at trying to bring in only who needs to be in to work effectively.
Great. Thanks for that, Shane. I'm conscious, I know people we committed to have, so we're only gone 2 minutes over. I know we have those couple of links there. I'll put that presentation up on our events page now, so if people want to access those links, just go back onto where this event was and that PDF will be there. Can I thank you very much sincerely, Shane? I think that was very informative. I think we will be coming back to this topic, so we might hopefully avail of your services again, if that's okay, in the next few weeks. But I think a lot of food for companies on the call. And just to say, I know your contact details are there, but you're absolutely happy to talk to anybody who has any further questions.
If anybody needs any clarification, they can send me an email or basically they can go through me there. Absolutely no problem. More than happy to do that. Yes.
Brilliant.
And again, I think the important thing is we're all learning on this all of the time, so it is a constant learning for everybody.
Great, perfect. Well, thank you so much. As normal, a recording of this webinar will be available on our members area. So for anybody who's on the call who wants to share it with colleagues, it's a very useful webinar to go back and visit. And we have 2 further webinars this week. So we have a webinar with Polly, previously Plantronics, tomorrow afternoon on remote working. And we have an Ask the Expert session with Annette Hickey of PayPal on Friday. So details of both of those webinars are up on the events page. So please spread the word, and thanks as always to Cormac for your support and our security blanket on all of these webinars. Thanks.
Fingers crossed, Dorothy, right?
Thanks a lot. See you again. Take care, everybody. Bye-bye.
Okay, thanks a lot. Thank you very much. Thanks a lot. Take care. Bye now. See you then.